So welcome everyone to our Well at Work Stories of Success webinar. My name is Kathleen Lane and I'm the Executive Director for the EdCan Network. I'd like to begin by recognizing that we live and work on the traditional territories of the First Nations, the Métis, and the Inuit people. I am personally joining from the unceded territory of the Squamish Nation in Squamish, British Columbia. Today's webinar is part of a series of webinars highlighting how schools and school districts across Canada are supporting the well-being of their staff and students. It's just one of the many ways that the EdCan Network is working towards our goal of fostering healthier workplaces to improve the outcomes for everyone in K-12 education. In addition to the Stories of Success webinars, we offer Well at Work Advisors services, professional learning opportunities, a pan-Canadian community of practice, and a wide variety of free resources available through our websites, k12wellatwork.ca and edcan.ca. And without further ado, it is my pleasure to introduce today's guests. Joining us today, we have Cindy Finn, Director General, and Jennifer Neill, Assistant Director of Human Resources from the Lester B. Pearson School Board. Welcome, Cindy and Jennifer. To kick us off, I'd love for you to provide a brief introduction to yourself and a little bit of context about your school board.
Absolutely. So good afternoon, good morning, wherever you find yourself in this great country. So yes, as Kathleen said, my name is Cindy Finn. So Jennifer and I work together in the Lester B. Pearson School Board. I've been in the role of Director General here at Lester B. Pearson since August of 2019. But I have been with the school board for over 25 years, just celebrating my 25th year work anniversary.
Congratulations.
Thank you. Prior to moving into the role of Director General, which for people across the country is equivalent to a CEO, Superintendent, Director of Education, whatever language you use in your respective province or territory. So I've been in this role for the last, I'm in year 6, but previously I worked in the Student Services Department and was responsible for all of the auxiliary curriculum services. So not instructional services per se, but all the professional services that support students, guidance counselors, psychologists, special inclusive education and special education consultants. My training is as a school psychologist. So I've always been very interested in how the adults in the world of school function and work together to support students. So as I say, I've been with the organization for a number of years. Lester B. Pearson is one of 9 English school boards in the province of Quebec. So we're part of the minority linguistic group in Quebec. So there are 9 English school boards that serve approximately 100,000 students. So in our particular school board, we serve around 24,000 students, and our students begin as young as 4 years old in kindergarten. We have full day kindergarten for 4-year-olds, and then we go all the way up into adult education and vocational training. So we do have students who are quite mature, and we offer a range of different services, all in an inclusive, equity-based, hopefully health promoting environment. We're in the Montreal area, so we have a mixture of schools. We're predominantly a suburban school district, but we do have schools in the inner city of southwestern Montreal, so in Verdun, LaSalle, and then our territory actually extends all the way to the Ontario border, where our smallest school is about 3 kilometers from the Ontario-Quebec border and has about 25 students K through 6. So we have quite a diverse range of school compositions and staff. I'll stop there and ask my colleague to introduce ourselves, and maybe she could say a little more about our workforce, our personnel, as she is the assistant director in HR.
Yes, so I'm Jennifer Neill. I come from the private sector. My background is a business background, but I have been with the school board since 2011, specifically in human resources since 2015. So as Cindy mentioned, I take care of support staff, professional staff, everything that has to do with health and safety. So our absences, our salary insurance leaves, our work accidents, long-term disabilities, that would be my team as well. And then also the labor relations for those employee groups as well. So we have a good idea of what affects our employees, and we see it through a lot of our data collection, and we hear it, firsthand.
Awesome. Thank you so much. So I know that Lester B. Pearson has been supporting employee well-being for quite some time now. Can I get the two of you to share a bit about where your journey started?
So I
Maybe,
can, yeah, I'll
go
start
ahead,
here a
Jen.
little bit because
Yes.
as Cindy mentioned, there are 9 English school boards in Quebec, and we're part of a system called CPNCA. So the human resource departments work very closely together. We meet once a month. And in 2017-18, that school year, we worked together to create an initiative where we were going to really try to get the pulse of our systems through something that was called the Total Health Index. So it would be a survey. So the preparation for that started. We all went back to our school boards and created a wellness committee at each of our boards, and we started the prep work for that survey, which we then rolled out in 2018-19 after a huge marketing campaign. So the survey, we finally had that done in May 2018. We got our results over the summer, just as we were being ready to roll out our initiatives and what we had originally planned for. Of course, that was the 2019-2020 school year. We got it off and running, where we started to let everybody know where our issues were, how we were going to start addressing them, what we were going to be doing for our staff, and then COVID, March 2020. So from there, we really sort of regrouped as a wellness committee of our school board, and we focused on, so essentially, maybe I can go back a little bit to the THI survey, the Total Health Index survey. We evaluated all pillars of a person's health. So there was physical, mental health, workplace health, and then life. So what their personal lives were bringing to the table. And as we realized, and as we already sort of established, you can't be well in one without it bleeding into the others, right? When you're not feeling well at home, it eventually will hit the workplace, et cetera, et cetera. So some of the initiatives we decided to put out there were touching upon each pillar. So we had Dr. George Sabangwe come and do online professional development for our entire school board. So those were over 3 separate days where everybody was home on there in the times of Zoom, the beginnings of Zooms. They were giant Zoom meetings. We contacted companies that were offering online physical exercises. So yoga, HIIT classes, that was very popular as well. We tried to implement online professional development to touch the work-life balance. We really tried to divide our sort of efforts based on the pillars. But again, that first year was predominantly online. Hey, Cindy, would you add to that?
Yeah, so we were very fortunate because when we started the survey, as Jen has alluded to, we really made a push. We worked with all of our unions, our associations, so everybody was well versed why we were doing this and that we wanted to use the data to inform some of the things that our employees were telling us that they needed. And so we were very happy because we were quite successful in that. We had 43% of our regular employees do the survey. So we felt very comfortable when they were telling us, this is where we do well. And the nice thing about that particular survey, it not only allowed us to see where we ranked, if you will, if we could compare ourselves to other English school boards as well as industry benchmarks. So how were people generally in education feeling? Because we were starting to see through the different HR departments in the various school boards, seeing, an increase in a lot of the more mental health, stress-related work leaves, in addition to medical illnesses, chronic illnesses, and things that were taking people away from work. So we wanted to survey our staff to better understand, like, how are you doing health-wise, and how are these factors interrelated, and what can we do as an employer, as someone who believes, I think even prior to this work beginning, we always knew that the teaching learning relationship is dependent on having healthy adults around children and having our students connect to adults as well as people connecting with each other, students in classrooms. So we really wanted to understand the needs of our staff, and that data allowed us to then go forward and try to plan. And COVID was an interesting experience, because although our results came in the spring of 2019, we were looking at them in the fall of 19 and starting to plan. When COVID hit, we realized, although it was a unique experience, the data was still robust enough that we went forward with all of our different initiatives, but it probably amplified. So the people that were struggling with stress before the pandemic, you know, there was even more reason to be stressed. The work-life balance thing, I think everybody could agree, became a very predominant thing, because a lot of people, especially during that time in 2020, from March to about July, we were closed. We were one of the provinces that, in the Montreal area anyway, we didn't reopen to students. So people were doing work online, they were teaching online, they were doing professional development online. So it was a very interesting time. But that's when we really dug into trying to provide and use the technology, as Jen's mentioned, use the technology to bring some of those services to people. So professional development webinars, time with the psychologists around stress management, managing the unmanageable was the way he phrased some of the talks we had, because it was a very stressful time for everybody.
Absolutely. So the Total Health Index looked at physical, mental, workplace, and home, like life health. And then you took actions in all of them as you've through a period of pandemic and then returning back into the classroom. And Cindy, you mentioned you worked really closely with your union partners. How has that evolved since that first launch of the pandemic? Are there areas that you have tended to focus on more once you got going? And what does that look like?
The other thing we should mention, something we offered fairly early on when the HR group began this work, they all did some online modular learning through a program with Morneau Chapelle and Queen's University. And so there was a certificate in mental health leadership that was offered. So our HR teams all did that first, and then we brought it to our full management team. And it was so timely because we were right in the thick of COVID. And so that was an added piece, in addition to some of the things we've already mentioned that came out of our survey. We knew that it was really important to look at mental health in the workplace. And so, yeah, a lot of our early work was based on some of the goals we wanted to accomplish. And I would say, you know, we've seen a trend in our board, and it perhaps mirrors what other school divisions and districts are seeing. We were very much focused on helping our staff have tools to deal with the struggles they had. So promoting our employee assistance program, directing people to various services, offering, as Jen mentioned, you know, online yoga, online meditation, online fitness classes. And we still promote that. We still think that's an important piece. Where we've moved, though, I would say in the last probably about 18 months to 2 years ago now, is as we came out of the pandemic, we realized there's a lot people can do individually, but we started to look more at what can we do in the workplace as a whole. How can we address or tackle some of those systemic barriers or some of those challenges that are more just the nature of the work we do with students in schools, with government, with parents, so many different stakeholders. And we've started to move more towards addressing collective issues in the workplace. So like, you know, the whole issue of respect and civility in the workplace, and trying to change our work environments or sensitize people that there's ways we can improve our learning. We always think of them as learning spaces because we're a school district. So how can we make our classrooms as welcoming and as warm and as safe as possible? How can our head office be a place where people can learn and grow and work together? And so we've moved, my feeling, and I'd be curious to know Jen's thoughts on that. I see us moving more towards, again, addressing the collective needs rather than saying to each staff member, okay, give yourself more skills to deal with these stressors because they're not going away. It's, well, can we tackle some of these stressors? Can we address some of these issues that seem to be bringing out a lot of psychological stress and even physical illness as a result of all of that stress?
Exactly. So if I could just add to that, that is one thing, you know, our wellness committee, we were really focused on sort of all these online exercise and professional development. But through that, I would say that our staff, and after COVID, our environment really started to feel more comfortable in verbalizing where their stressors were to human resources, specifically the health and safety team that we have here. So our wellness committee sort of shifted into looking at things through a civility lens. So we morphed into sort of a civility committee. How can we get people to feel, a sense of belonging again that seemed to be really lacking after COVID? Giving them the tools to feel, comfortable in addressing issues themselves. It's a lot of slights. People were feeling slights. People walk by each other in the halls. There was really a lacking of sort of community. So we started with the wellness committee that sort of morphed to the civility committee, where we put out a marketing campaign, about respect, about how we speak to each other, about sense of belonging. And then from that point, we really also, I think the government as well, if I can add that same year, the governments infused money into the collective agreements specific to mental health initiatives. So that sort of married really, really well for us, because we were able to use additional funds to set up things like conflict resolution, how to deal with difficult conversations. We had trauma-informed pedagogical practices, just really starting to equip everybody with the right tools on how to better manage those conversations in those situations. And then most recently, I would say since last year, probably, that then sort of evolved into what we call a dispute prevention resolution view of managing wellness and equipping our staff.
Amazing. So that sounds like quite the journey, shifting from
Yeah.
more of an individual focus well-being lens to looking at what can we do collectively to actually address the stresses instead of equipping people to overcome them. The examples of how you've started to address civility and improve respect within the workplace. That's fascinating. And then this prevention lens that you're bringing in, can you tell me more about that?
Yeah, I don't know, Cindy, you sit on that committee, so maybe you want to.
Yes. Yeah. So our wellness committee, as Jen described, we've sort of evolved over time, and we're now working on a program that's referred to as DPR. Again, it's a province-wide initiative that is supported through Ministry of Education funding. And so the acronym stands for Dispute Prevention and Resolution. And so it's really meant to understand that conflicts are normal. Conflicts are a part of life. People can have differences of opinion, but there's ways to go about addressing those. And if they don't get addressed, then problems can come from the fact that unresolved issues can then sort of become bigger over time, and they can actually, result in a dispute, which may go all the way to making a complaint in human resources about harassment or discrimination, or a union might decide to, say, look, and again, I'm just picking examples, things we've dealt with, like in Quebec, we have very harsh winters. But the last few winters, we've had a lot of ice and rain, and so schoolyards in the winter become a place where they can get quite icy. And so, we want to put in place, like, if there's a problem with icy paths, let's try to resolve it before we get to the point where the unions want to put in a grievance and say, you're not making sure we live in a physically safe and secure environment. And that translates from physical safety also into the psychological safety space. So we're really taking a broad lens at how can we prevent issues that come up from evolving or escalating into big problems, and can we equip people with tools? So what we've been doing for this with this committee for the last year or so is really defining for ourselves. Each school board is going to create their own guideline or framework about what can we do to accomplish this preventive work, and hopefully if we do head into a conflict space, how do we resolve it? And so we've created this guideline that will, we've started with all of our employee groups giving information saying we have this guideline, and it's the basic thing. If I have an issue with Jennifer, let's say in our workspace, that I go to her first and say, listen, I notice the noise coming out of your office is really loud. What can we do to fix that, rather than just letting it sit and evolve and evolve? So training people to assert themselves, to respectfully signal when there's an issue. And then if it doesn't get resolved, where do we go next? Do I then turn to someone Jennifer works with who could maybe coach her? Do I go to a supervisor? And so we're in the process of helping our employees understand that we will have more specific training to come to give people the skills to intervene. And it's very similar to what we've been doing for a long time in the classroom. With students, that we teach them how to have, nonviolent crisis intervention, that if two students are not getting along, that we try to help them problem solve it. And if not, you take it to other places where it can get resolved. So that's the work that we're going to be doing with our various employee groups. And we started that work just not too long ago, and we're working our way through our different employee groups to sensitize them that this work is being done, supported by all of our unions, supported by our Ministry of Education. And then, as I say, more training and tools will be given, especially to people in manager positions, leadership positions, so that they can take charge of situations, whether it's in an individual school or a particular department, so that they can continue to address concerns, reassure people, and really move through some of those psychological safety space issues. I'll also say, and Jennifer can speak more to it, but at the same time, there were some changes in the government, work prevention, the official, work accident prevention agency, that required us to also put in place occupational health and safety preventive teams. So we're also doing this work not just around conflict intervention, but everything. So I don't know if, Jen, you want to talk a little bit about some of the work that team does in helping prevent workplace situations.
Yeah, sure, absolutely. So in, I believe it was January 2021, the Quebec government changed a bill which had to do with our workplace safety. So from physical injuries or psychological injuries, they enforced that every Quebec organization had to have a focus and a plan related to prevention. So what we did in that case at our board, we hired a professional who her title is a prevention professional, as well as somebody that is called a health and safety representative. And the two of them work together, and they go into our schools and our centers. They observe the physical spaces. They also meet with different employees. They have their own health and safety email address, where employees, they don't need to involve human resources. They don't need to involve their principal. If they have an issue, they can reach them directly, and they will then go in and meet with everybody and assess the situation. And it really has been working marvelously for us. We have been able to, correct what are very easily correctable issues prior to them going to a government agency. Like for us, it's called the CNESST, where it would be an outside organization who doesn't understand maybe the education system, coming in and reviewing it from a very, standard lens without knowing all the nuances that we have in the education system. And then our employee group feels very comfortable knowing that they have this option, and somebody is hearing them, and someone is coming to assess, and it's really a neutral party. So they work very closely with our human resources, health and safety team. So there is a lot of collaboration there. They sit on our health and safety committee, which our syndical parties are present, our associations are present. So it's very, very collaborative, and we found that it has really helped improve the safety and the physical comfort level of a lot of our employees.
Amazing. So it sounds like throughout your journey towards well-being at Lester B. Pearson, there's been a huge emphasis on relationships, on collaboration, on providing people with the support to feel comfortable implementing the different initiatives that you are rolling out. We are coming up to our time. I would love to stop the recording and give folks online a moment to ask questions if they have any. But before I do that, are there any last things you would like to emphasize as we wrap up?
Maybe the one thing I'll mention, we didn't really get into too much, but we're a learning organization, and so education for us is so important in the preventive work we do. So we have really bought into the idea that, you know, knowledge is power, information is critical. So when our wellness committee started back in 2017, 2018, we then launched a wellness newsletter, and we were giving a lot of information to all of our employees, especially with links for we had meditation apps, anything that we had at our disposal, we were sharing. And similarly, the team that Jen is just speaking about, they now put out regularly postcards about different things. So as the cold weather's coming, I mentioned earlier, slippery sidewalks, helping people understand, like, dress properly for the weather, make sure you watch where you're walking. When it's really warm out, reminding people, if you're outside with the students, make sure you drink enough. If you're with students supervising them, make sure you're not outside in the sun too long. And you know, our caretakers making sure that they're not overexerting themselves. So we've really put a lot of emphasis on knowledge is information, and we can prevent a lot of difficulties from arising. And the feedback we get, you know, from our employees is they trust and they feel well supported by their employer. They know we can't really change the bigger working conditions. We will have, most of our schools are not air conditioned, and we will have snow, and but we can be better prepared. And those kinds of informational tools have gone over really well with our staff to help keep them informed and to make ourselves, you know, feel that, you know, we're all supporting each other through those different possible areas of accident or mishap.
Amazing. Thank you so much, Cindy, Jennifer, for joining us today to share your story.